Okay, so I'm going to explain the results for your lab report. So we were testing the efficacy of disinfectants for your hands. So we tested water before and after. I did this after the lab, and I just did this touching of the agar plate with my hands before and after I use water. And as you can see, we have all of these spots in the surface of the petri plate, which means are the colonies that grow. And anytime that you're counting colonies, if it's greater than 30 colonies on a petri plate, you call it two numerals to count, or TNTC. And as you can see, we have greater than 30 colonies before and after. So there is no change so much in the density of the population of colonies in the before and after treatment. So meaning that water is not very effective as a disinfectant. Now here we have Germex, this is benzalkonium chloride with lidocaine, and this is first aid. This is an antiseptic that is used for wounds, and it has lidocaine, which is it's an analgesic. But the first one that is supposed to be antiseptic to prevent the growth of bacteria that causes disease, it is benzalkonium chloride. And before we had greater than 30 colonies, I just put my fingertips in the wrong spot the other day when I did this test, or yesterday. So this one is supposed to be before, and this is after. Okay, so it's just a switch. So before we had greater than 30 colonies, and after greater than, 8 colonies. So when we did the calculation, we did it in the lab. We find out that it is, let's see, 87% effective. And then for this next one, which is Germex, is ethyl alcohol, 70%. That's the active ingredient. This is the hand sanitizer that we commonly know. It's having the same amount basically of colonies greater than 30 for the before and after, and meaning that this is not very effective. And then we have Heavy Cleanse, which is disinfectant that has chlorhexidine, and you need to add into your table a row to add this into the results. And before treatment there were 16 colonies, and after treatment will be 0 colonies. So the efficacy for this one was 100%. Why? Because out of the 16 before, you don't have any colonies after. And then for this one, the last, which is iodine povidone, this is 10%, and before we had many colonies, and after we only had 18, and the efficacy was 60%. Now, sometimes what it affects the results is just that we have to make these active ingredients to act at a certain period of time in our skin to be effective. That's why you have to read the instructions and follow the instructions. But this is one way then to test for the efficacy of disinfectants. And of course, this is something that it needs to be a little bit more carefully performed so we can have exact numbers. But for now, we have an idea of how to test for disinfectants, and this is all for this video. Bye-bye.